Hi, my name is Dr. Matt Bruninger. I'm Assistant Professor of Psychology and a licensed clinical psychologist. If you're watching this video, it's because you've agreed to participate in a study on self-guided hypnosis and God attachment. I wanted to take a moment to introduce you to this study and to answer any common misconceptions that you might have about hypnosis. So first, in this study, you'll be asked to fill out a baseline survey. This will be the longest survey that you have to fill out. Following the baseline survey, which you will fill out before you do any of the self-guided hypnosis, the subsequent surveys will be filled out at 3 weeks, 6 weeks, and 8 weeks. Those surveys will be shorter than the baseline survey. Each week on Sunday, you will receive an email that will have a very, very short 1-minute survey that asks you how many times you participated in self-guided hypnosis throughout the week. It should take no longer than 30 seconds to a minute to complete that. Also, on Sundays, you'll receive a phone call from a member in my psychology lab, and that individual will work with you to discuss any barriers or problems that you experienced in self-guided hypnosis for that given week. You'll receive a phone call weekly for 6 weeks, and that's your opportunity again to talk through any problems or difficulties you might be having. In the study, I ask that you spend about 15 to 20 minutes listening to the recording. It is a set recording, it is pre-recorded, and I ask that you find a quiet, calm place, preferably where you can be alone, but definitely a place where you feel comfortable sitting and listening and relaxing. You can use your phone and put earbuds in, you can play it via your computer, but please find a place that's calm, relaxing, and preferably where you feel comfortable engaging in a meditative like activity. So again, you'll be completing surveys at baseline, 3 weeks, 6 weeks, and 8 weeks. During or in between these surveys, each day you'll be engaged in self-guided hypnosis. So you might be asking yourself, what is hypnosis? There are a lot of misconceptions about what hypnosis is, and a lot of these misconceptions come from popular amusement or entertainment type shows that claim to use hypnosis. What we're using here is clinical hypnosis. Clinical hypnosis is a heightened state of relaxation. That's it. It's a heightened state of relaxation in which you're calm enough mentally to be open to more suggestion. You're more likely to experience and to be receptive to suggestions because you're so relaxed. That's all. So, as Catholics, it's important to think about how we use hypnosis. Why is this? As Catholics, we believe in free will. Everybody is endowed with free will. And as Catholics, it's our job, in order to uphold the dignity and freedom of the free will, to protect an individual's free will. So the question is, does hypnosis jeopardize your free will? And the answer is no. That is a common misconception about clinical hypnosis. When you are in a hypnotic state or this relaxed state, you will be able to come out of that state at any time if you so choose. If you were to hear a suggestion that was disturbing, frightening, off-putting in any way, you would have every opportunity and every ability to immediately come to out of the hypnotic state. So it does not strip you of your free will. It's really important. And I've ensured one of the safeguards to ensure that your free will remains intact is the fact that this will be a pre-recorded MP3. So you're not going into a hypnotic state in the presence of a stranger or somebody who might make unhelpful suggestions. You're entering the hypnotic state alone and with a pre-recorded CD that has only positive or helpful suggestions. Again, that's a safeguard to ensure that nobody can abuse this relaxed state that you will be in. What does the church say about hypnosis? The church tries to ensure in different documents and in moral theology manuals, the church says that it's important to ensure that no wrongful abuse of the one hypnotized occurs. And that's exactly why there's a pre-recorded MP3, to ensure that no abuses occur. Also, The Church notes that one may submit to hypnotic treatment for a grave reason if suitable precautions against its abuse are taken. I think that the reason for this particular treatment or intervention is grave. What we're seeking to address in this study is we're looking at individuals who have an attachment to God that we characterize as insecure. And insecure attachments can have a host of negative mental health and psychological distress associated with them. It doesn't mean that this insecure attachment causes them, but there is a relationship or a correlation between insecure attachments and psychological distress and other mental health concerns. And so I think it's of fundamental importance, not only for those reasons, but also that we might come to know and understand God as God truly is, that we determine whether or not this hypnotic intervention works. So again, I think this is a sufficiently grave reason. The purpose of the study is to try to take individuals who have an insecure attachment to God and through this hypnotic suggestion, see whether or not we can decrease the insecure attachment. I ask you each week to be honest with how often you're participating. Honesty is what is most important. If you haven't been able to do it as many times as you'd like, please be honest about that. I also ask you to be honest about any changes that might occur. If no changes occur, that's okay. Please just be honest. Sometimes we feel pulled or tempted to try to indicate that changes occurred because we want it to, because we think others expect it to, but what I want and what's most important for this study is your absolute honesty. Again, it is important, however, to try to the best of your ability to practice this every day. At most, it will take 20 minutes. And my hope is that you can find 20 minutes each day to engage in this hypnotic induction. If you have any other problems or questions, do not hesitate to email me at mbruninger, that's mbruninger @franciscan.com, or to call my office at 740-284-5363. Thanks for participating.